June 26, 2021 is the International Day Against Drug Abuse and Illicit Trafficking. This day is intended to raise awareness about the personal and societal challenges associated with chronic substance use. For some, substances can be used moderately and casually in their daily lives. For others, the continuous use of substances can be harmful. When substance use is deemed to be harmful to an individual, it can be classified as an addiction. This can include the use of both psychoactive drugs as well as other substances such as nicotine and alcohol. Substance use can often be a coping strategy for trauma or mental health challenges that occur in a person's life. A complex combination of biological, psychological, and social factors can contribute to one's substance use. Chronic substance use can have residual mental and physical health risks, those of which are increased for younger people. Although substance use is a universal phenomenon, racialized individuals are disproportionately targeted in its criminalization. This is not reflective of an increased prevalence of drug use in racialized communities, rather, systems upholding racist ideologies. COVID-19 related stressors have exacerbated the crisis of substance overuse as people are more and more frequently searching for a way to cope with distress. When it comes to substance use, opioids and fentanyl are of particular concern. The past 3 decades have given rise to an opioid epidemic. The rise in opioid overdose and related deaths has occurred in 3 distinct waves. First, in the 1990s, which involved prescription opioids such as methadone. Next, in 2010, with heroin overdose deaths. And finally, in 2013, with synthetic opioids, particularly fentanyl. Opioids trigger the release of endorphins, your brain's feel-good neurotransmitters. Those who take opioids often take them to relieve pain, in order to feel a sense of normality. However, opioids are highly addictive. Even with prescribed opioids, doctors are aware of the powerfully addictive potential of the drug and refrain from increasing dosage. Everyone is at risk of developing an addiction to opioids. This is because opioids cause structural changes in the brain, primarily in the mesolimbic reward system, building tolerance to the substance. Some illegally obtained drugs are mixed with contaminants, or more potent and dangerous opioids such as fentanyl. The high potency of fentanyl makes it deadly. Opioid addiction is complex, but treatment in the form of psychosocial or pharmacological interventions are available. It is estimated that 21% of Canadians will meet criteria for a substance use disorder at some point in their lifetime. However, not everyone decides to or is able to seek treatment. The decision to seek help can be a difficult one. Stigma surrounding drug use and addiction, comorbid mental health disorders, and external barriers such as treatment accessibility and cost are only some of the many factors that can prevent people in need of treatment from seeking it. If someone you know is suffering from addiction and is considering seeking treatment, there are things that you can do to help. Listen to their story and acknowledge that their situation is a difficult one. Choose your words carefully, avoid judgment, and avoid labels such as drug user or addict. If you or someone you know is suffering from addiction, there are a variety of treatment options that you can choose from. Treatment options for substance use include psychosocial and community treatments, residential treatments, support and recovery groups, and in certain cases, pharmacological treatment. Treatment can also involve psychological intervention, which addresses underlying emotional concerns and provides coping strategies that do not involve substance use. Some models of treatment focus on abstinence. Others, like the harm reduction approach, do not demand abstinence. Instead, they meet people where they are at and address the risks and conditions of use along with addiction itself. In recent years, the harm reduction strategy's success can be seen in Portugal. where the model was implemented nationwide and substance use was decriminalized. Portugal now has the lowest drug-related death rate in Western Europe. The Philippines unfortunately serves as a stark contrast. Their declared zero-tolerance war on drugs has tragically resulted in the deaths of thousands, including users, traffickers, and civilians. When considering treatment, remember that everyone is different. What works for some may not work for others. The best treatment option depends on a person's experiences, needs, and goals. Your healthcare provider can help you choose the best option for you. On the International Day Against Drug Abuse and Illicit Trafficking, it is important to recognize that regardless of background or circumstance, help for substance use and addiction is always available, and recovery is possible. For more information, and to find the resources used in the making of this video, take a look at the links in the description.